Welcome to the last webinar of Optimity Advisor's Integrated Care series. I hope you have enjoyed our 4 previous webinars. My name is Mariana Dates, and it's a pleasure to be hosting this webinar. So far in the series, we have covered why integrated care is important in the context of population health, why the context in which integrated care is developed really matters. We have presented a number of models of integration of care, and we have discussed implementation issues to make change happen. In this webinar, we're going to cover evaluation of integrated care. This is how we understand and act on the effects of integrated care implementation. Although the benefits of integrated care seem clear and implementation of integrated care seems now unstoppable, as shown by our own study funded by the EU Health Programme on Integrated Care Assessment, the evidence base to prove the effectiveness and even more so the cost effectiveness of integrated care approaches to care still emerging. The evaluation of integrated care initiatives is something that most actors involved in the integration of care are struggling with, from the policy level to the organizational level. As an example, if we observe the self-assessment of different European regions that have used the Scirocco tool presented in webinar 4 to establish their level of maturity in the implementation of integrated care, we see that the users have consistently scored themselves 3 or under in the domain evaluation methods. This is the case in the Basque Country, in Olomouc, and in Scotland. So what are the challenges to the evaluation of integrated care models or initiatives? In the report, Blocks, Tools and Methodologies to Assess Integrated Care in Europe, precursor to Optimity study, the European Commission's expert group on health system performance assessment recognizes that assessing the performance of integrated care is virtually virgin territory. The expert group also pointed out that measuring integration is different from measuring the performance of integrated care. Tools like the Scirocco maturity model are very important, but deal with the first issue. They allow to measure the level of integration and the maturity of a health system to implement integrated care. In this webinar, we focus on the second issue, how to assess or measure the performance of integrated care to evaluate if the interventions, programs, models, and even policies are obtaining the expected results. We've seen earlier in our series that integrated care has moved from being a stated goal to be delivered in practice in many different ways across Europe. These differences reflect the different political, economic, social, legal, and technical context in which integrated care models evolve. This diversity is necessary, and it should happen when health services start to shift the way they operate to put the patient at the center of care. But diversity and heterogeneity in the delivery of integrated care also creates challenges for understanding the performance of integrated care across country and even sometimes regional borders. In this sense, although we need to recognize that the customization and contextualization of the performance assessment framework is needed to a certain extent, it is important to establish a basic or core framework that allows comparison over time and across sites and settings. When co-designing a framework for assessing integrated care across Europe, we consider these issues carefully. The framework we propose considers that a focus on both process and outcome measures is essential irrespective of the maturity of a system's journey to integrated care. The availability of data that is relevant to measuring care integration is underdeveloped in many countries. Even when there is data, it is gathered, managed, and reported in different ways across countries. Policymakers and integrated care providers are looking for performance measures that are simple and easy to use and will support timely, evidence-based decisions as they mature as integrated care systems. To address these challenges, the framework we have developed has borrowed elements from frameworks that have been already validated and included in the bloc's report, such as the 2015 WHO's report on people-centered and integrated health services. Through extensive stakeholder engagement, we established which indicators can be considered: core indicators, disease indicators central to integrated care that should be easy to measure, and optional indicators, that is, indicators from existing frameworks that, although not considered central, may be valuable to those implementing integrated care. In the first round of our stakeholder consultation, we started from a long list of 147 indicators, and we narrowed it down to 56 indicators. In subsequent consultations, including a questionnaire, 2 webinars, and the final workshop, we narrowed down the list of core indicators even further and selected 18 for inclusion in the framework. The indicators selected were also rewarded and redefined to make them applicable across the diversity and heterogeneity of integrated care initiatives while offering measures for potential international comparison. The proposed set of 18 core indicators have been grouped in 4 domains: health outcomes, experiences of care, use of care services, and advancement of integration. The core indicators, together with the accompanying Excel tool, provides a flexible and coherent framework to support the implementation of integrated care adapted to the local context. It allows users to assess the performance of integrated care and helps them understand how resource allocation is linked to performance. As the integration of care evolves, the framework will need to be updated and adapted to new circumstances. Therefore, capturing the breadth of additional indicators instead of discarding them would facilitate the evolution of the framework according to practice, but still be based on evidence and robust methodological approaches. We hope you have enjoyed our webinar series and have found it useful. If you haven't seen the previous webinar, I would highly recommend that you do so when you have the chance. Thank you for your time.